Good morning, everyone. Thank you, Cooper. Nice to see you in the Bee Congress, first Bee Congress in the Pacific, and we sweet people around the Pacific. I just want to share some information about the how we managing our pests and diseases in Fiji. So hopefully some of the things I can transfer you, and at the same time I can get it some from you as well, because it's a unique area we working on in the Pacific with a lot of challenges, a lot of things we have to focus on that. Okay, moving forward, I just taking my presentation and just talk about pests and diseases and how we managing and things. Before going for my main topic, I just want to highlight a little bit about my organization. It's a commercial statutory authority, right? And under Public Enterprises Act. Currently, actually, it is a government-owned public enterprise. It's government-owned public businesses, right? So our mandate is to protect Fiji from introducing pests and diseases into the country, both plant and animal, and also spreading of that one, how we're going to stop that to support the agriculture, human health, animal health, plant health, and all. So that's our mandate. And also, we want to create opportunities for our farmers, our exporters, and also maintain the food security within the country. So that's one, and we supporting to our main partner in Ministry of Agriculture here, how they, especially in this case, right? And also we manage in the border controls, the quarantine controls as our borders, and also we doing drafting the import protocols and export certification as well. So basically that is our role. And this is our pest and disease surveillance is part of this our major or main mandate within the organization. If you go in for our disease of concern in Fiji, we mainly focus in the WOHA, or World Organization for Animal Health listed diseases. And basically the six diseases are listed in this the standard or the code. And so out of that we have 2 diseases present in Fiji, right? Rest of the never reported, and perhaps we need some more information about, because the baseline information is left with us to see that diseases are present or not. But again, like some of the research conducted in the past in 2013 and around that time, they highlighted most of the diseases are not present in, except this one. But recently we got an incursion of varroa, and 2018, we got to know that one in 2018, but that time it's a bit late for us to fully contain that one, right? So that is one of challenge here in the Pacific, especially the small island countries. If you're not having the capacities, especially the diagnostic and all, we facing challenges in the disease and the pest in the region, right? Currently, we working on the our partners, our supporters from the region, especially ICR and also CSRO, just to screen our virus diseases, because we have the varroa mites here. But fortunate for that, because we have a varroa jacobsoni, not the destructor. So in that case, we save. But again, looking at the current challenges around the region, even in the situation in Australia and all, so we have to keep our eyes, we have to strengthen our borders, because it's going to be a devastating effect for us to, especially the blooming industry in Fiji. So we have to work on collaboratively, and also we have to strengthen and increase our resources, our capacities within the country. So we're working on the screening of bee viruses, and also some of the fungal diseases as well related to the bees. We have identified few issues, like this is giving us to develop our capacities where we're lacking, and also strengthen some of the areas to handle or address some of the upcoming challenges in the industry. So we've seen some of the, I think our colleagues also highlighted in the first the panel discussion, saying we have like a lack of management skills with most of the farmers. I'm not saying that it's a general, but it's, I mean, if you're coming into that one, you should know that one, how you manage your hives and all. I think you better understand that one when you are doing the one. And also the knowledge and the exposure for the beekeeping practices. And also it's linked to the how you're getting the resources, something like bee suit and the other tools and all. It's not available, readily available, not available in the region. So you have to import, or maybe you have to pay for additional cost for that one to manage this one. So some of the beekeepers very hardly getting this stuff. So we need that sort of supplying of the resources within the region. So that's another area we have to look at that one. So those are the things we identified over, few years when we working with the bees and in Fiji. So basically our main focus on the strengthening our capacities within country to support our people, our farmers, and entire industry, and to improve their livelihoods in the region. I'm going back to the two diseases. Then I'm going to discuss a little bit about this, how we are managing at this moment, and how we using the technologies, some of the technologies available with us, and also our area of focus on managing this. So first, I'm taking the American foul brood, and I'm not going to detail about this one, because you know, as the beekeepers and the experts here, you know very well about this disease. And the challenge is here how fast you detect this disease. So over the period, we realized that when some of the hives, they are unattended or not properly maintained, and it's died off, that one. And especially when we are supplying the hives to the projects, we got to know that we have done some analysis, like some of the places, they received around 60 hives, and end of the day is remaining 1 or 2, but still those hives are just wild colonies around that region. So that's the challenge you are facing with this one, if you are not train our people, our farmers at the very beginning when you're doing this. So yes, we have to do that, and to maintain this one. And also it's creating issue to the other beekeepers as well. If you're harboring the disease, eventually it's spread into the one. So that is the main thing we have to focus on, that one, especially when you're talking about the AFB. Our main target is to identify the infected hives and eradicate at the same time. So we developed sort of field diagnostics, especially the visual inspection, the routinous test and all. And also since 2016, we introduced the rapid test kit, Vita Europe test kits. That's the one we preferred for that one to diagnose at the field level. So we use that one. But again, now we have a bit of a challenge, like how fast we detect the AFB with this test kit. I'm not criticizing the test kit, but again, like the challenges we are facing at this moment. So we need another level of engagement in the diagnostic services. So we are not using any antibiotic to treat this one. Once we identified it's tested positive, we straight away eradicate that hives. And is thank for the Fiji beekeepers, they are willing to eradicate their hives without any compensation. That's the major challenge, and it's in like how we're going to restore those things. And I think we have discussed a couple of times, but still we struggling to come up with some sort of a solution for that one. Perhaps maybe during this forum, we can come up with some sort of like a way of compensating, or way of handling something this thing, because eradication things is really challenging when you come into your livelihood, and if impacting the businesses and all. So that's the one I have to highlight, especially when we eradicate in that one. And currently AFB is confined into certain areas, and we strictly control the movement of that the areas as well as within Fiji. I think our Fiji Beekeepers Association is greatly help us all the time to manage this one, and perhaps introducing the protocol and also it's how you reach into the farmers, because awareness is a very important point in that one. They're raising that, if you're not aware about that, the disease and how it's spread and all these things, and it's very hard to implement, even if you have strong legal backup for that one. But this collaboration is the main important thing for us. Looking at this map and over 4 years with our data, still we have some areas free of AFB, and we confine into some pockets in one. But recent past, we realized that one is tend to be come out from the infected zones, and perhaps it's linked to swarming colonies, or the wild colonies, or else the movements within the region. So we have to work with the beekeepers again, and also we have some discussion with our technical expert, Dr. Cooper, Dr. Robert, and the team, how we're going to have some program for that one to clearly demarcate the areas. One thing is that. Other thing is that how fast we detect this one. Perhaps we have to introduce the other level of testing capabilities within Fiji. So we continuously doing our surveillance around Fiji, including our islands, and it's draw a bit of funding from our resources. But again, we have to keep the industry running and keep the containment of these diseases around Fiji. So that is our the main focus on the Vita Europe AFB test kits. We're using AFB, EFB in both the diseases. We've screened that one during the surveillance. So another one, 6 months interval, we issuing a emergency declaration that is restricting the movement of beehives within Fiji, and until unless we give the authority. Basically, we need to have the clear farms to move out the AFB, especially the AFB positive areas. And if it is a clear farm, then we give in the like a clearance to move out from that hives. Otherwise, we are not giving. We have a sort of a SOP in place, and it agreed with our beekeepers association and the bee farmers, and then how we implement that one in Fiji. So this is just to highlight a little bit of what our movement control forms and all. I think it's a bit of like a not clear in the one, but perhaps our team is aware about, and also the farmers, and they have to apply for a permit to move their hives for breeding purposes, or maybe extraction if you are moving away from about more than 4 kilometers. So we have some SOPs in place with that, just to maintain the disease within that region. And also we started our molecular work now, and we have the capacity now, and we have tested some of the samples, and we draw up sample from AFB positive sites as well as negative sites with the Vita Europe test kits, and some of the negative sites we giving sort of a positive results, but these results are not validated yet, but we need to have a proper protocol, because I just highlighted this one just to say that one, if you use in the technology, we can detect the AFB very soon and at very initial stage, because if you see the clinical signs, it's already infected maybe your other hives within the farm. So we need to understand that one and develop this capacity. We already started that. Perhaps technically we getting the support from our experts around the region, including New Zealand MPI. And this is how we're doing that one, just to highlight. And another disease, the varroa mite. For varroa mite also, we're doing some surveillance at the moment, but unfortunately it's widely spread. But still we have some areas free of varroa, especially small islands, and where we're keeping our breeding stock, mainly imported stuff. And I think you already aware about that one. We imported some queen bees from Australia. So for this one also, we have a SOP, standard operation procedures, to how we're going to move and how we're going to control this one. But again, it's more or less like a collaboration between the the farmers and the authorities and also government agencies. So we have to, introduce sort of integrated pest management system for this one to handle this one. But again, like we are a bit of a out of control kind of like I would say that one. But again, we need some area of focus on this varroa mite, especially to the control the current burden and looking at some of the discussion with the bee farmers and some of the our colleagues in the industry. Just to highlight some of the lessons learned from the varroa, and we have first detected in this one in 2018 and in Suwa area, and during our trace back it's identified that one it's introduced procured bee hive from another area within the region, the central division, and somehow this varroa is introduced to that particular farm, the source farm. From there, it distributed to different places in short period of time. And that's how it spread to the all around Fiji. And that is of, sort of alarming us as how you're going to early detecting the hives, the pest in your hives. So it is very, very important for us. So this is sort of a lesson learned for us. That's why we try to introduce sort of a sentinel hive program for us, and especially targeting the varroa destructor and some of the other concerned pests around the region. So currently, this is the distribution of varroa within Fiji, and still you can see some areas free of varroa. We have continued to maintain that one, but again, like it's a bit of a challenging one because varroa is moving with the swarming colonies, and naturally movement is also there. But our initial discussion or initial surveillance information revealed that when it's move with the movement of hives as well. That's the biggest challenge in the varroa. If you're not detected at the very stage, then it's spreading very fast. That's what's happened in 2018 around that one. And during our entire assessment in 2018, perhaps it's introduced around 2015, 2016 period. And that's the time they have introduced. And we believe that when it's through a hitchhiking swarming colony through a vessel. So that's how we identified, but lack of information to the traceback audit, it's a bit of challenging us to create a exact introduction or the time of introduction to the country. So continue to the other surveillance, especially the bee viral diseases and support from the CSRO, Dr. Robert and them. And because we have a varroa mite here, forget about this destructor, the other one, and we want to continue the monitoring the most economically important viral diseases as well, especially the deformed wing virus and all. So, but during our initial screening of viruses, we detected sackbrood viruses in Fiji in different places. So we need sort of enhanced surveillance for that one, and to see that one is where is the spread and the what is the prevalence of this virus as well. So we continue to do that one at least every 2 years period, just to keep the information flowing for us to make decisions and implementing control programs. I think you're already aware about. I just to highlight a little bit. Just why I'm highlighting the genetic improvement is one way of challenging the diseases, but not all the time. But some of the diseases you can come out with the genetic improvement of that one. So, and also enhancing the production in a way. Main thing is that how our team performing best for managing the diseases. So continuously we need training for them and keep them updated for their knowledge and their practices, their skills. That is a key point for us when we effectively implementing the disease control program not even the bees, but for others. So we continuously training our team from in-house as well as from the expert from the region, and sharing the information, sharing the knowledge, and also we getting some of the practical solution for that, some of the disease control programs. And because the challenges here, we have to find a different protocol, different methods to handle some of the issues we facing during the beekeeping or beekeeper management in the region. So way forward, as I highlighted, the collaborative approach may be the best one for us, and we need the regional collaboration as well as in-country collaboration, and perhaps the technical support from region and the training capacities and all these things. And also work together with the beekeepers is another good way to work with. And like end of the day, we try to protect them, and they also have that responsibility to protect their businesses and all. And we continue to, screening our hotspots areas, especially for AFB, and improving our diagnostic capacities, and also early detection system, especially the Sentinel Hive program. Perhaps we can get a lot of learning from our New Caledonia team, and how they're managing currently in island setting. That's the best opportunity for us. Yeah. I think, thank you, Vinaka Valevu, and yeah.